Oui, opérateur, on peut transférer tous les appels avec le son ambiant de la salle.
Parfait, je transfère ça immédiatement. All participants, please stand by. Your conference will begin momentarily. À tous les participants, votre conférence débutera sous peu.
Thirty seconds, 30 secondes. Heads up.
Bonjour tout le monde. Je
Hello,
suis
everyone.
très heureux d'être
I'm
ici ce
very
matin
pleased to be
en
here
compagnie de la
today,
ministre
accompanied
Anand,
by Minister
du
Anand,
Major Général
Major
Fortin
General
et de la
Fortin,
Dr Tam et du
and Dr.
Dr.
Tam and Dr. Njoo.
I want to address the news we got last night that Master Sailor Dwayne Earl of the HMCS Winnipeg is believed to have gone overboard in the Pacific. As Minister Sajjan has said, we are dedicating every resource to the search. To Master Sailor Earl's family and loved ones, we're keeping you in our thoughts during this incredibly difficult time. And to everyone aboard HMCS Winnipeg, we are standing with you. I know that this has already been a very challenging year for those serving in the Canadian Armed Forces. This morning, I just came from visiting the Ottawa Hospital. I spoke to nurses, doctors, and staff about delivering vaccine doses. I also thank them for their outstanding work, day in, day out, throughout the months of this pandemic, for everything they're doing to keep us and our loved ones safe. C'était un grand plaisir pour moi ce matin.
It was a great pleasure for me this morning to go to the Ottawa Hospital to meet with the frontline workers and to thank them directly for all the incredible work that they've been doing. We are seeing the end with the arrival of vaccines, but there remains a lot of work to be done to make sure that Canadians are safe over the next few months. I know that they'll continue to be there for us.
The very first doses of a COVID-19 vaccine arrived in Canada. Less than 24 hours later, vaccinations had already started for the most vulnerable and frontline workers. This morning, I have even more good news to share. I can announce that Canada has secured our second agreement for early doses of COVID-19 vaccines. Canada is now contracted to receive up to 168,000 doses of the Moderna COVID-19 vaccine before the end of December, pending Health Canada approval. These doses are part of the guaranteed 40 million doses we have secured from Moderna, and deliveries could begin within 48 hours of regulatory approval. Like the co-founder of Moderna pointed out a few weeks ago, Canada was among the very first to pre-order their vaccine. That, combined with our solid plan for vaccine rollout, is why we have an agreement for early doses. As with the early shipments of the Pfizer vaccine, this moves us even further forward on getting Canadians protected as quickly as possible. The regulatory process for the Moderna vaccine is ongoing, but again, I want to assure Canadians that any vaccine approved in Canada will be both safe and effective. Je suis heureux d'annoncer aujourd'hui que le Canada
I am pleased to announce today that Canada has reached a second agreement to receive early doses of vaccine against COVID-19. This agreement foresees the delivery of 168,000 doses of the Moderna COVID-19 before the end of December. These doses are part of the 40 million doses agreed to with Moderna. Delivery could begin 48 hours after regulatory approval, as it was the case for the Pfizer vaccine. This news means that we can make further progress to protect Canadians. The approval process is still underway for the approval of the Moderna vaccine. Once again, I would like to reassure Canadians, every vaccine approved in Canada is safe and effective.
and no community will be left behind. We have a plan to reach everyone who wants a vaccine, no matter where they live. Of course, shipping in the winter, especially to the far north, isn't without its challenges. The Moderna vaccine does not need some of the extra special handling requirements of the one from Pfizer, including ultra-cold freezers, and that makes it a better option to ship over long distances to more remote areas. So doses of this vaccine will be directed to the north, as well as to remote and Indigenous communities. The territories are scheduled to receive doses of the Moderna vaccine in the coming weeks, pending Health Canada approval. We're working to ensure the logistics planning is ready when vaccines are available and have already shipped medical-grade freezers to the north. As soon as we get the green light, we'll be ready to go. On Pfizer, I also have an update to share. We've now confirmed that next week we will receive about 200,000 of our total early doses from Pfizer. As well, we will have 70 sites ready to administer these doses, up from 14 sites this week. À propos de Pfizer, je peux aussi partager d'autres.
As to Pfizer, I have an update to share. We have now confirmed that next week we will receive about 200,000 of our total early doses from Pfizer. As well, we will have 70 sites ready to administer these doses, so 56 more than this week. Canada has now has agreements to receive up to 417,000 early doses before January the 1st. I would like to thank Minister Anand for her incredible leadership in this file. I would like to highlight the remarkable work that has been done by Major General Fortin, his team, and all the employees of public health to ensure that this vaccine rollout is done. This is a pan-Canadian effort. Our government will continue to work jointly with provinces and territories through the intermediary of the National Operations Centre to make sure that doses will be distributed to citizens as quickly as possible. As I announced during the Premier's meeting last week, the federal government will cover 100% of the cost of these vaccines and necessary equipment. Vaccines will be free for Canadians. Provinces and territories won't have to delve into their budgets to pay for vaccine costs.
Also continuing to invest in treatments for COVID-19. Today, I can announce that we are providing up to $6.7 million for the Canadian company Arch BioPartners to support the development of their leading drug candidate to treat severe cases of COVID-19. This new funding was provided on the advice of Canada's leading experts in the field who are serving on our COVID-19 Therapeutics Task Force. Progress on made-in-Canada treatments, a second agreement for early delivery of vaccine doses, the most vulnerable already starting to receive these life-saving shots. This is the good news we all needed. This pandemic will end. We will get through this. But for now, we need to be incredibly careful. Keep each other safe. Keep your grandparents safe. Keep our doctors and nurses safe. Do the things you know that are going to help us get through this long winter. Vaccines are coming. Vaccines are already here. But we need to make it through this winter in the best possible situation without seeing more tragedies, without seeing more losses. And that means we all have to do our part. Nos premiers vaccins sont en train d'arriver.
Our first vaccines are arriving. Now is not the time to gather over the holidays. We have to be careful and continue with our efforts. Keep distance. Wear a mask. Use the COVID Alert app. Avoid gatherings. Wash your hands frequently. Continue to do all that we have to do to protect one another. This has been a very long year, 2020. But in 2021, we will be able to celebrate together when this pandemic will finally be over. We can see the end. We see the end with vaccines, but we still have to remain careful. We still have to do everything in our power, everything we know that we need to do to protect our loved ones.
Is protecting Canadians. That's why we've been working around the clock on procuring everything from PPE to rapid tests to safe, effective vaccines. But let's remember, this is a global pandemic. To end COVID-19 anywhere, we have to end it everywhere. Pour se débarrasser rapidement de la COVID-19, il faut que les
To rapidly get rid of COVID-19, everyone has to have access to vaccines as quickly as possible. Yesterday, Ministers Gould and Anand announced that Canada would invest a supplementary amount of $485 million in a worldwide cooperation to accelerate access to tools to fight against COVID-19. This investment will provide treatments and vaccines, as well as healthcare resources to developing countries. What's more, in order to continue to protect the health of the most vulnerable citizens, Minister Gould announced that Canada would also provide funding to help different countries with nutrition and food safety programs. The fight against COVID-19 is a worldwide effort. We need to work together to fight this virus and build a stronger and more healthy future for all.
Finally, I want to end this morning by recognizing that today marks the 5th anniversary of the Truth and Reconciliation Commission's final report. The residential school system was one of the darkest chapters in our history. It has left a tragic legacy that continues to this day. To the survivors, family members, and all those who shared their truth, your courage and strength is remarkable. I also want to recognize the leadership of Senator Murray Sinclair, who's retiring from the Senate in January. His work as the Chief Commissioner changed Canada for the better. Senator Sinclair, like so many others who were part of the Commission, showed us the path forward, and it's up to all of us to walk the path of reconciliation. Together with survivors and communities, we have made important progress on the Commission's calls to action. 80% of the calls that are the sole or shared responsibility of the federal government are now completed or well underway. In the last few weeks alone, we invested $500 million to support Indigenous communities in exercising their jurisdiction over child and family services. We introduced legislation to implement the United Nations Declaration on the Rights of Indigenous Peoples. Our government will continue to work in partnership on everything from closing gaps in infrastructure to ending inequalities in the criminal justice system. We have moved forward, but we're not done yet. The national tragedy of missing and murdered Indigenous women and girls must finally end. Over the last 5 years, we've worked with partners and communities to put a stop to violence against Indigenous women, girls, LGBTQ, and Two-Spirit people. Aujourd'hui, La ministre Bennett a souligné les investissements qui nous permettront de continuer.
Today, Minister Bennett highlighted investments that would allow us to go forward, especially establishing new shelters and having an overall strategy for violence prevention. Our government continues to be a partner in these efforts for reconciliation and to build a better future for all. Thank you, everyone. I will now give the floor to Dr. Tam.
Bonjour, good day to everyone. There have been 468,862 cases of COVID-19 in Canada, including 13,553 deaths. Nationally, there are over 75,842 active cases across the country. And yesterday, 6,731 cases were reported nationally. In addition, there were almost 1,400 new cases reported for Saturday and Sunday, and this brings the average daily case count to over 6,540 cases for the past week. The number of people experiencing severe illness continues to increase. So over the past 7 days, there were an average of 3,020 individuals with COVID-19 being treated in Canadian hospitals, including over 600 in critical care, and an average of over 110 deaths were reported each day. Following last week's authorization of the first COVID-19 vaccine for use in Canada, the National Advisory Committee on Immunization, Canada's independent expert advisory group on immunization, has released recommendations on the use of the Pfizer-BioNTech COVID-19 vaccine. NACI's recommendations include important guidance on its safe and effective administration, and this includes the time interval between the first and second dose of the vaccine, and considerations for special populations, such as pregnant women and individuals who are immunocompromised or who have a severe allergic reaction to any of the components used in the vaccine. Canada's expert recommendations will support the provinces and territories and Indigenous leaders in the rollout of the COVID-19 immunization campaign across jurisdictions. As the COVID-19 landscape continues to evolve, NACI recommendations will be updated with additional evidence on authorized vaccines as it becomes available. Yesterday was a day of hope and excitement. Less than a week following the approval of the first vaccine, we began to hear and see the experiences of the first people vaccinated against COVID-19 in Canada, including personal support workers in Ontario and residents of long-term care in Quebec. Today, we have more good news with the prospect of the early availability of the Moderna vaccine once it receives regulatory approval. It is evident from the pace with which we have been able to move from approval to delivery and rollout of the first vaccination programs for priority populations that the ground has been well prepared for the next chapter in our response. As we move into this next chapter of Canada's COVID-19 response, I want to focus on a special ingredient that has and will continue to underpin our success. That is the partnership between public health and the public at large. When we all work together, each of us doing our part to reduce the likelihood of getting infected and spreading the virus, we are helping our health workforce. Our continued efforts are not only helping public health to quickly interrupt chains of transmission, we're also assisting the broader health workforce to plan for and roll out one of the most complex immunization campaigns in Canada's history. Canadians can continue to help by following public health advice and keeping up with good hygienic habits, physical distancing, hand washing, and mask wearing to prevent the spread of COVID-19 while we prepare the ground for widespread and lasting control through immunization. Thank you.
Bonjour à toutes et à tous. Il y a eu 400...
Hello, everyone. There have been 468,862 cases of COVID-19 in Canada, including 13,553 deaths. Nationally, there are over 75,842 active cases across the country. Yesterday, 6,731 cases were reported nationally. In addition, there were almost 1,400 new cases reported for Saturday and Sunday. This brings the average daily case count to over 6,540 cases for the past week. The number of people experiencing serious illness continues to increase. Over the past 7 days, there were on average 3,020 individuals with COVID-19 being treated in Canadian hospitals, and over 600 in critical care, and an average of over 110 deaths were reported each day. Following last week's authorization of the first COVID-19 vaccine for use in Canada, the National Advisory Committee on Immunization, NACI, Canada's independent expert advisory group on immunization, has released recommendations on the use of the Pfizer-BioNTech COVID-19 vaccine. NACI's recommendations include important guidance on its safe and effective administration. This includes time interval between the first and second dose of the vaccine and considerations for special populations, such as pregnant women and individuals who are immunocompromised or who have had a severe allergic reaction to any of the components used in the Pfizer-BioNTech COVID-19 vaccine. NACI's expert recommendations will support the provinces and territories and Indigenous leaders in the rollout of the COVID-19 immunization campaign across jurisdictions. As the COVID-19 landscape continues to evolve, NACI recommendations will be updated with additional evidence on authorized vaccines as it becomes available. Yesterday was a day of hope and excitement. Less than a week following the approval of the Pfizer-BioNTech vaccine, we began to hear and see the experiences of the first people vaccinated against COVID-19 in Canada, including personal support workers in Ontario and residents of long-term care in Quebec. Today, we have more good news with the prospect of early availability of the Moderna vaccine once it receives regulatory approval. It is evident from the pace with which we've been able to move from approval to delivery and rollout of the first vaccination programs for priority populations that the ground has been well prepared for the next chapter in our response to COVID-19. As we move into this next chapter of Canada's COVID-19 response, I want to focus on a special ingredient that has and will continue to underpin our success. That is the partnership between public health and the public at large. When we all work together, each of us doing our part to reduce the likelihood of getting infected and spreading the virus, we are helping our health workforce. Our continued efforts are not only helping public health to quickly interrupt chains of transmission, we are also assisting the broader health workforce to plan for and roll out one of the most complex immunization campaigns in Canada's history. Canadians can continue to help by following public health advice and keeping up with good hygiene habits, physical distancing, hand washing, and mask wearing to prevent the spread of COVID-19 while we prepare the ground for widespread and lasting control through immunization. Thank you.
Merci beaucoup, Dr. Njoo. Le premier ministre est disponible pour prendre des questions pendant 20 minutes aujourd'hui. La ministre Anand, les docteurs et le major général Fortin resteront disponibles pour une autre période de 20 minutes. The Prime Minister will be available to answer questions for 20 minutes today. Minister Anand, doctors, and Major General Fortin will remain available for another 20 minutes to answer more questions. Starting with the phone, en commençant par le téléphone. Opérateur, c'est à vous.
Thank you. Merci. First question, Ryan Talty, National Post. Your line is open.
Yeah, good morning, Prime Minister. One of the companies that received military support for its long-term care homes when they were failing paid substantial dividends to its investors throughout the course of the year. Given that Canadian taxpayers paid for the military to be there, as well as to support those long-term care homes in a number of other ways, do you think it's right that that company was paying dividends to its shareholders? in the millions of dollars while it needed the military support?
I think those are certainly questions to ask, Ryan, and I know over the coming months there will be many reflections by Canadians and others on that. Our focus from the very beginning was to just be there for Canadians who needed help, whether it was rolling out unprecedented direct supports like the CERB and the wage subsidy, whether it was shipping PPE to the provinces and giving them extra support for their healthcare systems, or whether it was directly through sending in the Canadian Armed Forces to support in long-term care homes. Our preoccupation was just being there for Canadians, and that's exactly what we did.
Following up, Ryan?
Yeah, on another issue, with the vaccines that you're announced today with Pfizer and Moderna, do we have a forecast for which one we expect will come next and which one we think will be key to really expanding the vaccine rollout to go beyond the targeted groups that we're seeing now?
Well, first of all, we know that we're expecting millions of doses in the first months of 2021 through Pfizer and Moderna. But at the same time, there are two other vaccine candidates going through the Health Canada rolling review regulatory process as we speak. And we are certainly optimistic that there will be more vaccines approved with more doses. As you know, Canada has secured a better and larger range of potential vaccine suppliers than just about any other country to secure more doses per capita for Canadians than for any other country in the world. So we are very, very well positioned, but every step of the way, Health Canada needs to do its full, rigorous approvals process so that any vaccine approved in Canada will be guaranteed to be safe and effective.
Merci. Opérateur, next question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Hello, Mr. Trudeau. This is twice that you've announced an early arrival of vaccine. This is more than what was expected. Is it more costly to receive early doses of vaccines? Since the beginning, and since the summer, in fact, we've been working with different companies. As the head of Moderna said a few weeks ago, the fact that Canada was one of the first countries to sign an agreement with Moderna gives us some advantages with regards to their capacity to deliver early doses of vaccine. I'm very pleased to give the floor to Minister Anand. She was responsible for these contracts.
Merci beaucoup pour la...
Thank you for the question. This is a very important question. As the Prime Minister just said, this is part of our agreement with vaccine companies. That is to say, to negotiate terms with regards to the cost of vaccines. We have to pay the fair market value of these vaccines. This is very important. Our priority is to receive vaccines here in Canada for all of the Canadian citizens. This is my #1 priority. It's the priority of our government. And we will have vaccines here in this country. We will have some vaccines in December, and that's the most important thing to know. Yes, I'm going to ask the same question because the answer wasn't really what I'm looking for. Is it more expensive to receive early doses? And secondly, are you expecting Health Canada to approve the Moderna vaccine this week?
I have answered this question, I believe, last week, and I'll just refresh that response because it remains accurate, that there is a continued negotiation about the deliveries of these vaccines and the terms of the deliveries. And as we push for earlier deliveries for Canadians and for the health and safety of Canadians during this crucial time, we are paying fair market value of these vaccines. And in addition, Could you just remind me what your second question was?
Oui, when would
Oui.
the
Well,
Moderna
oui, ça
vaccine
c'est
could be approved?
important.
Oui.
Oui, mais je voudrais dire que
Yes, that's important, but I would like to say that I have no role to play in the approval process for the vaccines, and that is the right way to do this. We have to allow Health Canada to do their very important work using the expertise of this organization. And afterwards, we will be ready to receive delivery of vaccines. Yes, the approval of vaccines is not a political issue. Experts at Health Canada do their job, and this is what they do for all medication or all vaccines in Canada, even in normal times. They have an approval process with many necessary steps. We've heard that things are well underway for the Moderna vaccine, and we might receive an answer next week. So if this approval is provided, we are well positioned to receive hundreds of thousands of doses of the Moderna vaccine even before the end of December. But obviously, the work that needs to be done by Health Canada has to be done without any type of compromise, and they will do everything to approve these vaccines as soon as possible.
Thank you. Merci. Next question, Brett Forster, APTN News. Line open.
Hello, Prime Minister. The TRC commissioners have offered a very different take on your government's reconciliation progress than the one you just offered in your remarks. They say the progress has been slow, uneven, and that your government still doesn't have a tangible plan to implement their calls to action. How do you respond to their criticism?
First of all, I welcome and thank the commissioners, not just for their extraordinary work over the past decade that set Canada on a better course for the future, but their continued engagement in making sure that reconciliation is something taken on not just by the federal government, but by provinces and territories, and indeed by non-Indigenous Canadians as well, because we all need to be partners in this process. Over the past 5 years, we have completed or are well underway on 80% of the TRC calls to action that directly touch the federal government. But there's a lot more to do, and we are going to continue working on that. We know that what took generations and indeed centuries to break and to destroy will take more than 5 years to fix. But the work that we have done as a government has been more than any other government in the past, and we're just getting started. We know how much more there is to do, and we will continue to work with strong voices in leadership like the TRC commissions and Indigenous communities right across the country to move forward on reconciliation.
Following up, Mr. Foster.
Yes, thank you. So again, the commissioners, of course, said they welcome these recent announcements and what progress has been made, but they're also sounding alarm about the pace of action. They want to see you renew that sense of urgency. So what do you say to that?
I share their impatience. I share the sense of urgency. Certainly, this pandemic has demonstrated yet again just how vulnerable certain Indigenous communities are and how much we need to continue to work even faster on the path of reconciliation. But at the same time, we need to remember that as much as Ottawa might want to put forward the answers and move forward very quickly, it can't be that way. We need to do this in partnership, hand in hand with Indigenous communities who need to determine their future and their path. And we have to be there to support, to resource, and to accompany them. And that always takes a little bit longer. But I share your impatience, Brett. I share the impatience of the commissioners. I share the impatience of all Canadians to continue doing the hard work of reconciliation and move forward as quickly as possible to the better country we know is ahead of us down this shared road.
Thank you. Moving to the room now. Rachel?
Hi, Prime Minister. Rachel Haynes from CTV National News. Should corporations and private medical labs in Canada be able to purchase vaccines to give to their own employees and clients? Is that consistent with the principles of the Canada Health Act?
Our priority is ensuring that all Canadians have access to a free, safe, and effective vaccine as soon as possible. The deals, the contracts we have signed with 7 different potential vaccine producers, the contracts we have signed for potentially up to 10 doses per Canadian over the coming months will ensure that all Canadians get access to a free and safe vaccine. Private companies can make their decisions as they wish. None of that will have any impact on the fact that all Canadians who want one will get a free vaccine in the coming months of 2021.
Steve Chase, Globe and Mail. Good afternoon. I'm here to ask you about Dominic Barton and the opioid crisis that's devastating communities across North America. He is, of course, your ambassador to China, but was previously your government's top economic advisor. And of course, he was the man in charge at McKinsey & Company, the global consulting firm, for almost a decade. So what Canadians might not know is the role that McKinsey played in helping to boost sales of OxyContin for Purdue Pharma. This is the company, of course, which is now, whose role is being examined in the courts. So even as Mr. Barton was offering you economic advice on how to boost growth here, the opioid crisis was unfolding and causing financial ruin and personal ruin across North America. Now, in recent days, court documents revealed that McKinsey was actually proposing, and this is under Mr. Barton's leadership, paying rebates to pharmacists so they wouldn't stop dispensing OxyContin if there had been overdoses in their area. Now, what we're trying to figure out is what Mr. Barton knew about this. At a House of Commons committee he appeared before last week, asked him, was he aware of this work, which a former McKinsey consultant called the Banality of Evil MBA edition? He didn't answer. He said he told the House of Commons committee to look at the McKinsey website where there's an apology for this. The apology makes no mention of Mr. Barton's role in this. We then called McKinsey and we asked them, what role did Mr. Barton play in this? Was he aware of this? They said to call Mr. Barton. We called Mr. Barton. He didn't reply to us. We talked to your office. Your office didn't reply to us. So we're here to ask you, have you asked Mr. Barton whether he was aware of what was happening at McKinsey under his tenure?
Dominic Barton is an extraordinary Canadian who is doing great work for us in China as Canada's ambassador. He has a long history in business and in economics and is the right person to continue moving forward at a very difficult time in Canada-China relations. His leadership on bringing home, on working hard to bring home the 2 Michaels, his defense of Canadian interests, including Canadian commercial interests, and his continued engagement on creating opportunities and growth for Canadians makes him an outstanding representative, and I'm pleased to have him by my side on the international stage as we work very hard to both stand up for Canadian values and to move forward on building a better future. In regards to the opioids epidemic, this government has been extraordinarily active from day one, whether it's been partnering with provinces and territories on responses, working directly with frontline workers, or moving forward on approval of safe consumption sites, which there was one when we took office. Now there are dozens and dozens all across the country. We know there is much more to do to counter this extraordinary tragedy that is hitting so many families across the country. Even as we deal with this COVID pandemic, the opioids epidemic continues as well. We will keep doing everything we can to support Canadians and keep them safe in the coming years.
Thank you. Next question in the room.
Hélène Buzetti du Devoir. Bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau. I'd like to come back to this this idea that you will ensure that the French language is used. You're talking about the Official Languages Act. What would the Official Official Languages Act allow you to do that Bill 101 doesn't allow you to do? What is the difference between the two? Well, we know that Canada is a bilingual country, but for Canada to remain a bilingual country, Quebec has to be a francophone province. And that is why, even though we are there to defend official languages and minority official languages throughout the country, we will, as we said in the speech from the throne, be there to defend the French language in Quebec. That is why we are looking at the modernization of the Official Languages Act. This review is due, and there will be measures to protect French everywhere, including in Quebec. We're still working on it, but I would like to highlight that I completely agree with the former premiers of Quebec and Quebecers who are concerned by the decline of the French language, and I am as well. We will work in order to protect French in Quebec. What's more, we will do everything we need to protect French in Quebec. The federal government does have a responsibility to protect the French language throughout the country. It's not just to protect the French language in Quebec, but in Saint-Boniface, in Timmins, in Caraquet, in Moncton. We were able to defend and save the project for the French Language University in Ontario when conservative politicians wanted to cut this. We have appointed bilingual judges to the Supreme Court of Canada, and we will continue to work in order to modernize the Official Languages Act of Canada in order to protect this beautiful French language. Laurence Martin, Radio-Canada. We see, Mr. Trudeau, we see a lot of Canadians hugely concerned about the vaccine. They don't want to have the vaccine. What are you concretely going to do in the weeks and months to come to overcome this vaccine hesitancy? There's a lot of work that needs to be done in order to demonstrate that our plan that begins with the approval coming from Health Canada and then healthcare professionals who deliver the vaccine, and this is headed so well by Major General Fortin. We are extremely fortunate to have many things in place that will reassure Canadians. We can see that with these first doses, we see the safety of this vaccine. This is clearly demonstrated to Canadians. And yes, politicians will encourage people to get the vaccine. And personally speaking, as soon as I will have the opportunity, and it will be my turn, I will get vaccinated with great enthusiasm. But I do know that it's the doctors, scientists, people who work in public health will be listened to. They have been listened to by Canadians throughout the country during the entire pandemic. They will reassure Canadians that all vaccines available in Canada will be safe and effective. Since the very beginning, Canadians have listened to advice coming from public health, doctors, experts, specialists, and we have had a lot of tragedy during this crisis, but we've managed relatively well compared to other countries. We will continue to trust our scientists and our public health experts. I am fully confident that Canadians will be very reassured to see the extent to which we have rigorous processes in place and excellent public health experts, and this will demonstrate that it is the correct thing to do, that is to be immunized with this safe and effective vaccine to finally end this pandemic.
Question dans la salle?
Prime Minister Michael Couture with Global National. I wanted to ask you, last week Dr. Bonnie Henry said that there's information that they, quote, received internationally and from Canadian agencies that there's been a concerted effort to try and interrupt the cold chain, for example, and sabotage immunization programs. How concerned are you about that, especially given the fact that we're now ramping up the number of vaccination sites, and how are we going to secure this and prevent any kind of sabotage?
Part of reassuring Canadians about the safety and efficiency of the vaccine is not just the extraordinarily rigorous Health Canada approval process, which was done quicker than usual, but without cutting any corners or taking shortcuts. The amount of resources we put forward, the amount of unprecedented cooperation and collaboration across allies and with the medical community has allowed for a full approval of these vaccines. Furthermore, the logistical delivery of those vaccines has been extraordinarily important to establish, to secure, and to ensure no interference or problems along that chain. And that's why we are so fortunate to have Major General Dany Fortin leading the logistical rollout of these vaccines and ensuring the integrity and the safety of that supply chain. And I'm happy to turn to him right now. Dany, if you could speak to the safety and integrity of the supply chain.
Thank you, Prime Minister. As I indicated before, there are a number of threat indicators that we're closely monitoring between the agencies, intelligence service, the law enforcement agencies. The appropriate level of information is shared down the line to provinces and territories, to the law enforcement agencies so that they take concrete actions. The logistics service providers, UPS, FedEx and NMR joint venture, they take the appropriate measures as they are responsible to deliver along the cold chain. They monitor threats along the transfer points, and they take the appropriate measures as well. What I could say to all Canadians is that the appropriate measures are being taken by the appropriate organizations. And while I understand that there are questions about possible risks at a location or another, rest assured that it's being closely monitored by all parties.
Thank you. We have time for 2 quick questions.
Hi, Prime Minister. Tom Perry, CBC. On the Moderna vaccine, you were talking about doses going to the north and to Indigenous communities. Is that entire first shipment going to be going north, going to these communities, or other groups or regions going to be getting it? And on the Pfizer vaccine, the 200,000 doses coming in, is that still going to be going on a per capita basis, or do you see a time where you're going to have to start prioritizing areas with a higher case count?
Excellent questions, Tom. First of all, we've been working very, very closely, not just with Moderna, but with premiers of the territories and with leaders in remote and Indigenous communities to look at their schedule of delivery, their availability of resources to ensure that the most vulnerable are prioritized first. We will have more to announce in the coming days as Moderna firms up its own logistical and rollout plans, but you can rest assured that the conversations that I've had directly with the provinces and specifically on Moderna with the territories have gone very, very well, and people can rest assured that our capacity to get the vaccines to people who need it most and earliest will continue, and like I said, we'll have more to say on that in the coming days. In regards to Pfizer, the rollout schedule is continuing to be worked on. We have to understand that these are companies that are ramping up production in a massive way, rapidly, of a product that needs to be safe and secure every step of the way. There is uncertainties in their production. Our responsibility is to provide certainty on logistics and on delivery, and that's exactly what we are focused on. But I'm sure Minister Anand could add a little bit on both Moderna and Pfizer.
Thank you so much, Prime Minister. Just to build on the logistics question that you asked, Tom, we are responsible for transit into Canada of the Moderna vaccine. So unlike Pfizer, that is bringing that vaccine to us and actually delivering the vaccines to the sites themselves, Canada will be picking up the Moderna vaccine, and that is work that is going on now to ensure that the logistics are in place to go and pick up the Moderna vaccine And in terms of the shipment of the Pfizer vaccine, which was the second part of your question, we will have 70 sites ready to administer those doses, which is up from 14 sites this week. So you can see that, as the Prime Minister rightly mentioned, we are all ramping up. The companies are ramping up their production, and at the same time, here in Canada, we are ensuring that logistics systems are in place for the distribution of these vaccines right across the country.
Liberthium Canadian Press, sir. I wanted to ask about the RCMP watchdog report this morning. It says that it was acceptable for the Mounties to monitor demonstrations, record video of protesters, scour social media and other open sources for information about activists protesting the now defunct Northern Gateway Pipeline project, and collect license plate numbers for intelligence gathering purposes. I was wondering if you agree with this assessment from the watchdog.
Obviously, this is an important report, and we're going to take a careful look at it and its recommendations as well as conclusions. We know there is much to do to improve the RCMP in terms of systemic discrimination, systemic racism, and how it deals with certain groups. That is work that is being done not just with the RCMP, but in police forces and intelligence and security agencies right across the country. We will, of course, take careful note of recommendations coming from broad sources on how to move forward with the right solutions for Canada and for Canadians.
Thank you, Prime Minister. This is all the time you have with us today.
Thank you. Merci. Prochaine question, Émilie Bergeron, à vous.
Oui, bonjour.
Hello. I have a question on the distribution of the Moderna vaccines. Will this be similar to the Pfizer vaccine? Will it be on a prorated basis, or are you going to change the criteria? For instance, increased availability for Indigenous populations? This is Major General Fortin. The distribution of the Moderna vaccine and the detailed planning is underway. We are undertaking an exercise that began today. It's a dry run. Boxes are sent from the processing plant and then are sent to identified points by our logistical services provider, FedEx and Omar. Now, as for in-depth planning, it will be on a per capita basis, and we will target isolated communities and northern territories. So, as a distribution point, when the vaccine will be approved in Canada, these distribution points includes isolated regions and urban areas and the north. Okay. So, with regards.
Same in English?
Yeah, of course.
Okay. So the distribution for Moderna vaccine is, the planning of it is well underway. This week, we're executing a dry run exercise as similar to what we did last week with Pfizer product. We have orders in, so boxes will be shipped, but boxes that do not contain vaccines will be shipped this week from the manufacturer. This process is very much underway. 2 points of distribution in provinces and territories, and then that allows us to really tweak, adjust as we about to embark in the distribution. When the vaccine becomes available and authorized for distribution in Canada, this will be distributed on a per capita basis to provinces and territories, very much putting the territories and the remote and isolated areas as part of this plan and as part of the initial distribution.
Suivi?
It's Dr. Njoo. Maybe I could
sorry.
Elaborate from a public health perspective. As we've said previously, our planning assumption has been sort of the overall 6 million doses for the first quarter, and that's a combination of the Pfizer vaccine Moderna. And what we've also indicated is that at this point, understanding is that it's 4 million doses of Pfizer and 2 million doses of Moderna. So that's a 2-to-1 ratio. So using that as the envelope, we all agreed at the public health tables that it would be a per capita allocation. But as we also said previously, there are challenges in the north. The territories have indicated to us that no, it doesn't make sense for them to receive their sort of proportion or their portion of the doses in Pfizer product because it's too challenging to use logistically. So they would prefer to use all Moderna product once that's approved. So when you think about it, with good collaboration by the other provinces, their ratio would be more than 2-to-1 if you look at the, sort of the overall envelope. And that's what's going on now, as Major General Fortin has indicated. It's a bit of sort of adjustment for the fact that the territories will get all of their doses in Moderna product, none with Pfizer, and also that their shipment will be hopefully moved up as soon as possible. It doesn't make sense to give them in small shipments. They're saying, well, you know, your one priority group will give you this week, and then the next week it might be something else. It's better to give it all at once. They can go into the communities and vaccinate, obviously, the populations that you need to vaccinate. So I think hopefully that provides more clarity, because I know it's been confusing looking at sort of the two products, the overall envelope, and so on. Thank you. Avec notre...
Ma question.
Oh, hang on, we're just going to go in French. Hang on.
Selon les principes de...
According to our planning process with our counterparts in provinces and territories, we are planning for 6 million doses of vaccine for the first quarter. So it's 4 million doses of Pfizer and 2 million from Moderna. And there's always this principle that is used that we will attribute vaccines. This 6 million doses will be on a per capita allocation. We also know that for the Northern Territories, it is too difficult for them to use Pfizer, the Pfizer vaccine, because of the logistical difficulties linked to this. Everyone agrees that for the Northern Territories, they will receive only the Moderna vaccine. So if we continue this, it is a good cooperation with the other provinces to say, okay, instead of having a 2-to-1 ratio, Pfizer to Moderna, if we give 100% of Moderna vaccine to the territories, the other provinces have to accept a higher proportion of the Pfizer vaccine. And so these are the different logistical considerations that are underway and being discussed with our provincial and territorial counterparts. But that's the principle.
Yes, thank you. Oui, donc, mon suivi.
Here's my follow-up question. Prime Minister Trudeau said that there would be 70 sites for Pfizer, for the use of the Pfizer vaccine. And so is this as of next week? There will be a total of 70 vaccination sites. So, Major General Fortin, could you please speak to the distribution for each province? Yes. We will have 70 vaccination sites next week. Some provinces will increase by 1 or 2 on a more progressive fashion. Others have a greater capacity and more population and have decided to activate more sites. These points of use are underway. We are now confirming the preparation. Provinces indicate if they're ready according to criteria that we set together. We're headed in the right direction in order to ramp up the number of vaccination sites next week for rapid and efficient vaccine distribution for all Canadians. In the future, there will be more sites as we will have increased quantity of vaccine available, and this will be when we have considerable increase in all places, and the sites might become redundant and will have to close. So it's in the hands of the provinces and territories with regards to the distribution sites. They might have to change their distribution pattern.
On va prendre une autre question par téléphone et on va retourner à la salle pour 2 questions. Prochaine question.
Merci. Next question, Justin Ling, freelance. Line open.
Hey, good afternoon. So in the last couple of days, we've been asking about the computer system that's designed to track the COVID-19 vaccine rollout, including monitoring of the cold storage. And we've gotten a kind of a lack of clarity about why it's taken this long to actually ask industry for submissions on this. And there's not a whole lot of clarity about when we actually expect to get the system online. The request for proposal says January. Major General Fortin, yesterday you said in the coming months. So I'm wondering if you can tell us why it took till November 30th for you to ask industry for proposals, and when you actually expect this new system, which you call mission critical, to be online.
Hi, Justin. I'll start and then I'll hand it over to the officials from PHAC and Major General Dany Fortin. So we are ensuring that we have full functionality in place from an IT perspective for their surveillance and monitoring of the mass vaccination program that is now ramping up in Canada. I want to be clear that the system that the Public Health Agency of Canada has in place is functional already and has been utilized for vaccination programs such as the flu vaccine. So the idea underlying the process that PSPC is undertaking is to provide further functionality to an existing operational system to enhance what is currently in place at the time that we are having this conversation, in fact. And that's a point that has to be recognized, that this country has been engaging in mass vaccinations of the flu vaccine for decades. And so we're ensuring that the existing systems are enhanced with this process that we have issued via RFP directly to pre-selected suppliers. I will also say that we are doing it on a very expeditious time frame from the time at which we received an indication from the Public Health Agency of Canada to undertake this process. And on that note, I will hand it over to the officials at the Public Health Agency of Canada or Major General Dany Fortin.
This is Theresa. Maybe I'll start. And I think as exactly as Minister Anand has said, the provinces have existing programs and systems that monitors their individual immunization programs, and that this goes on every single year, and particularly for the influenza vaccine campaign, which they vaccinated more people this year than any other year as well. But I think this is a great opportunity to enhance systems and connect the provinces across the country as well. And I think, not that you couldn't do it with existing systems, it may make things more efficient and be able to enhance the operationality of the rollout process. I don't know if Major General Fortin has anything to add, but it's just to enhance functionality.
Thank you, Dr. Tam. Thank you, Minister. I think I would say that there hasn't been a job that I've done in the last couple of decades where there wasn't an issue with IT and with upgrading softwares and the challenges that creates. And in the absence of the best option available, we currently have systems where we're closely coordinating with provinces and territories. We get the information that we require. Could it be streamlined and be more efficient? I think the answer to that is yes, and that is what the agency and with PSPC Canada, Government of Canada is trying to will acquire.
And I guess I will just wrap up this response by saying that we have to remember that we weren't expecting to get December doses, that we've been aggressively negotiating with suppliers 4 early doses of these vaccines over the last number of weeks and months. And it is as a result of those negotiations and the aggressive posture that we have brought to the table with fortitude that we have been able to secure these early doses for Canadians. And at the same time, we are putting in place the logistics system so well in hand with Major Dany, General Fortin.
Follow up?
Yeah, frankly, it shouldn't have come as a surprise to the government that we would have to figure out a more expansive system for managing the rollout. I'm wondering if you can tell me how this new system is supposed to interact with Panorama, which was supposed to be the sort of pan-Canadian solution for vaccine tracking, or is it going to run parallel? Is there a consideration of building on top of Panorama, or is this system going to be entirely separate from it?
Well, it's Theresa's time. I can start. The provinces each have their own registries. There's only one jurisdiction that doesn't have it. So that's just, Panorama is a broad suite of different modules that manages different aspects of public health programming. And the system, there's only one territory that does not have currently these registries, but they've picked different kind of platforms, if you like, to execute them. And I think that if we can connect the dots, then that's an enhancement on what we have now. But it's not because the provinces can't track who they vaccinated and to follow them up with the second dose. That's their job. But this system, because of the complexity of the supply chain and the transportation and making sure that there's good visibility of where doses are, et cetera, I think the platform, as I understand it, but we can provide more information, is to enhance that capability. Normally, you don't get these situations where Pfizer, for example, is delivering to points of use. This is normally, vaccines normally go to the provinces and they get on with executing the program. So there are some special aspects of this. But needless to say that all of this is being tracked right now in meticulous detail, as we have been doing in the dry runs.
Okay, we'll turn to the room. Marika, go ahead.
Hi, Marika Walsh with the Globe and Mail. Minister Anand, I'm wondering if you can explain to Canadians who are seeing our vaccine rollout versus the rollout in the US, for example, why in the time that the US is expecting to inoculate a third of their population, we will just be doing around 8% of our population.
Sure, thank you so much. I want to take you back to August and July when we were negotiating these agreements, and we were indeed among the very first countries to sign agreements with Moderna and Pfizer, for example, and then we put into place very rapidly 7 agreements for up to 414 million doses for this country. The highest number of doses per capita of any country in the world, which I think we should all remember is the case. At that point, we were not sure, in fact, no one was sure, when a vaccine would be discovered as a viable technology and when Health Canada would thereafter be able to provide approval to that vaccine. And as a result, what we put in place were windows of delivery in Q1, Q2, Q3, and Q4 of 2021 on the basis of the estimated time frame for the development of a vaccine and Health Canada approval. The manufacturing of these vaccines, as you know, is occurring outside this country. So in addition to those provisions in our contracts, we also ensured to have a diverse range of manufacturing sites around the world from which we could obtain these vaccines. That was an extremely complicated process. And now that we see Health Canada moving so quickly with the approval process, we are attempting, and successfully so, to move up the delivery dates of the vaccines that indeed are being produced outside of this country. So we are not only at the beginning of the line, the EU is still moving to approve Pfizer, and I believe that's expected to come next week. So we are at the front of the line in terms of countries, and we are actually making sure that Canadians and the inoculation process that is occurring here is actually very well positioned in terms of Canadians' access to vaccines.
I guess that's where my confusion is, though, because the line from your government is that Canada is the best positioned in the world. We have options for more than 400 million vaccines, but we're seeing that we are going to be after others. So is it that we just bet on the wrong quarter in 2020? Or can you just explain why it is that it comes later in the year next year?
Well, by the end of 2021 or September 2021, we expect all Canadians to be able to be vaccinated if they choose to do so. And indeed, we are among the first countries to actually undertake our vaccination process. So it's not a line per se, it is actually the truth. The other point that I want to mention is that the mass production of vaccines is occurring outside of our borders. And so our access to these vaccines takes into account that fact. And I want to remind the room that we actually are the first country to have an agreement with AstraZeneca where there is not domestic biomanufacturing of vaccines. And so we're working with a number of complicated variables here. And in my estimation, we are continuing to ensure that vaccines arrive in this country in a very expeditious manner with systems put in place with experts like Major General Dany Fortin. Thank you.
Okay, we'll take one last question from the room.
Laurence Martin de Radio-Canada. Moi, je voudrais juste clarifier.
I would like to clarify for the 6 million doses that will arrive between now and the end of March. You said that 4 million are from Pfizer, 2 million from Moderna. Moderna will go only to the territories. The provinces will receive a mix of Pfizer and Moderna. So for these 6 million doses, and this includes new Moderna doses, so this will be distributed on a per capita basis? It will a per capita allocation? Yes. I would like to hear you speak, Mr. Njoo, on the issue of disinformation. I asked the question of Mr. Trudeau, but you work at public health. Are you concerned? And do you think that we should do more? Do you think, because right now we hear a lot of Canadians say that they don't want to get a vaccine, and you're fighting for people to get a vaccine. Do you think that you should have an ad campaign or a public awareness campaign so that people will get the vaccine? Answer. Thank you for the question. I think that there are many components to this. And especially when we talk about a campaign, to reassure people and to increase the level of trust in a vaccine. I think that a very important first step is something that we've already spoken about, is to reassure Canadians. We have one of the most stringent regulatory approval processes in the world. So any vaccine that is approved in Canada, we know that it is safe and effective, without a question. Now, with logistics, I think that it's amazing because we have begun vaccinating people yesterday, and I think it's really important, and the media are part of this. It's a good news story to show people who can speak to their own experience. And I heard interviews with seniors and healthcare workers that got a vaccine, and they feel very excited. There's a wow factor. They say, I've done the best thing for myself, for my patients, for my family. This is very important. It's a second step. And I think that there's also another very important step. We know that Healthcare providers, such as doctors, are a dependable source of information for their patients, and they are credible. For us, it's extremely important to provide them the information in order to increase their trust levels so that they can have a conversation with their patients. We've already begun with webinars, I think, and I think this was available in English yesterday and French today, and we will continue with this. It's very important to use the network of healthcare providers throughout the country. This is the third step. With an ad campaign, to provide Canadians with information, we also have to use different means. Press conferences such as these are for some Canadians, perhaps older Canadians. I can tell you that my children are not watching these press conferences, so other means might be used, TikTok or YouTube. I'm not sure. So we have to use our communications experts to find different ways to reach different populations. Are you considering this? Yes, of course. Even in April, I did a few YouTube videos with influencers, and apparently, I don't know, but I'm not a YouTube star, but one of them has over 200,000 views, and even my children said, "Wow, my friend saw you on YouTube." So this is something else, but we will continue with our efforts, and I also think it's important for the public at large. If people continue to use the internet, that has to be done in a more careful way. We have to be careful, but also to say, okay, well, people have to be discerning and to see where are they receiving their information? Is it somebody that they don't know, someone with no credentials? It can be someone in their basement. Or is it coming from public health or the WHO? So people have to assume a certain level of responsibility. There's a lot of clickbait things on the internet, but no, that's not what people are clicking things and they're sending it to their friends, but no, this just spreads disinformation. So I think that there's a role to be played by the government, but we have a responsibility. We all have a responsibility to be informed, and I think that we will succeed together. That's all for the press conference.
About how high transmission has been recently, and we are heading into Christmas. So when we are talking about messaging and reaching different people, is it time to change the messaging? Is limiting your contacts working?
So I think everything has to be sort of done at the same time. So individual actions are actually really important, but at the same time, public health and governments also have to do the part. It's a bit of a combination of both. So I think individual behavior is a very difficult thing to sort of pull people together to make sure they stay on track. We've heard, we've been in this for months, and people are, Christmas is a difficult time. People want to connect with families, but we're asking people to connect in safer ways. But as you've seen with the escalation in cases, provinces and also municipalities are having to put down extra measures. They're more restrictive. It's not something that they want to do, and they've tried balancing acts of keeping certain things open and keeping schools open, etc. But that is not really slowing things down. We've seen provinces such as Manitoba that enacted more restrictive measures, and they are beginning to level up. I think the critical indicator that has spurred people, different levels of government on the ground into these further measures is the hospitalizations and the ICU admission rates. So people have questioned, well, if there's lots of cases and they're mild, why are we, restricting society in this way? And it's a really difficult question. But when you see hospitals getting filled and healthcare workers completely exhausted trying to maintain the system, that is really difficult. You can't manage that anymore. And public health is also on the edge of, they can't trace people anymore. This is community transmission. They've lost track of contacts. They're trying their hardest to do lab testing. So therefore, you can't just rely on individual actions. So these other measures are being put in place. Some of them have increased these more stringent measures in the last days. So we are going to have to keep at this to see if that would level off the curve itself. It's really important to do this as we begin the vaccination program. The vaccine, as it starts, is going to be small amounts. That's not going to be enough to extinguish any fires, as it were. And so we need to continue. There'll be more and more information about how effective these vaccines are in reducing transmission, for example. We don't know it yet. So for the time being, our message is to everyone to continue. It's not one side or the other, it's the combination. I always say there's public health is called public health for a reason. There's the word public in public health, and it takes both in order for things to actually be effective. So, but there's great hope, you know, with lots of treatments coming on board and vaccines. So I think I'm definitely looking forward to 2021 being a better year.
Tom, one last question.
Ask you, you mapped out for us last week the Pfizer vaccine coming from Belgium to Kentucky to Canada. Can you do the same for the Moderna vaccine? Where is it coming from, what route it's taking, and I guess who's transporting it? And how long as well? How long a process is it?
Yeah, thanks. So I mapped out the route last week for the dry run of the Pfizer product. The exact specifics of the location of the transfer points and the different airports and mode of transportation, I prefer to not disclose this at this time. Provinces and territories will disclose the appropriate level of granularity in terms of location